I just add something? Is it on?
Absolutely.
Can I add something else to this? Because I was a total novice about the whole vein procedure. I'd had problems for years, and my mother also had stripping of veins done. And I was very scared of the whole thing. But I must say, the procedures were all, and I had all of them, all four that you mentioned, were absolutely painless, except for, you know, some aftercare on some of the more invasive ones. So I just want to say that to everyone that doesn't know that.
Well, thank you for saying that. And no, we didn't have her sit there so that she could tell us how great we are. But I think that that's a pretty common response. Wouldn't you say, Stephanie?
I would say so. I think the patients, it's really interesting when we have a patient that had one leg stripped and nothing done to the other leg, and they come in and they develop varicose veins on the other leg, and we do these treatments, and they compare it, and they remember having the stripping, and they remember the aftercare and the pain, and they just can't believe how easy it is and how nice the recovery time is. So it's very important that these patients understand that it's not like it used to be.
Mm-hmm. Absolutely.
I was a stripper at one time. No. and honestly, I think what you're saying is really true. When a patient had both legs that were involved, we would try to do both at the same time, because if I did one, they weren't coming back. When I started 12 years ago doing minimally invasive procedures, I did the one leg, and going back to where, you know, the holding area where they were, they said, when can we do our next one? They were like energized. So the procedures have become really patient-friendly, as well as doctor-friendly.
Right. Doctor-friendly for sure. That's one of the things that makes it wonderful for us to be phlebologists nowadays.